This is part 6 of a series of videos on isotretinoin, also known as Accutane or Roaccutane, and depression and suicide. It's been stated by dermatologists on the internet that there's no evidence for an association between Accutane and depression, and that's false. It was shown in a FDA dermatologic subcommittee meeting in which there was people from industry, academia, and the FDA on the topic of Accutane and depression, that where Marilyn Pitts presented 41 cases of challenge, de-challenge, re-challenge, which is proof in and of itself that Accutane can cause depression. That is, that they take the drug, become depressed, go off the drug, and the depression improves, and then they take it again and they get depressed again. That alone, according to the textbook of pharmacoepidemiology, is proof of a causal association. So I'm not sure why this continues to be debated. There's also over 400 cases reported by Diane Wasowski of the FDA at that same meeting. And so those two pieces of evidence alone were enough for Rogers and peers in a paper in 2008 published in a scientific journal to conclude that there's no other medication in the world that has stronger evidence for an association with drug-induced depression. DID is drug-induced depression, as Accutane. That's listed there in the table as isotretinoin based on that evidence alone, and based on a prescription symmetry, based on a case crossover study performed by Azulay and published in 2008 in the journal Clinical Psychiatry, in which they found that the risk of depression diagnosis and treatment with antidepressants was increased by 2.68-fold compared to being treated with not being treated with Accutane. So based on that evidence, the conclusion is that there is a connection between Accutane and depression. In the other videos, I talked about the biological associations, and this is a drug that originally was used for as a chemotherapy agent for cancer. It grew to almost $1 billion a year of sales, as being prescribed by dermatologists for minor pimples, when originally it was only approved by the FDA for the treatment of cystic acne with scarring.